I have 100% blocked SFA with stents that have what's the word? Reblocked. And bypass has been mentioned, although I walk a lot, so I have pretty good collaterals. But every day I have pain when I'm walking. So bypass has been mentioned. My question is, like, I don't want to invite more trouble by getting a bypass and then have it fail. And so my question is are all bypasses destined to fail? And also, what about the new thing? And Kim, you might need to chime in, TFAO or T
P-TAP.
something,
So
P-TAP.
and we do have a couple of doctors coming on later
Oh,
this month to talk about P-TAP, but as well, it's the detour system,
yeah.
where you're
Okay,
using
okay, okay,
hijacking
okay.
a vein in the thigh.
So am I better
So,
off to leave it alone and just do my best to keep walking since I am right
how
now? I've
long can
never
you
had a
walk without any pain?
Oh, I don't walk far, but I mean, today I did a hike. I did 4 miles, but I have pain. But
Okay, but
I'm doing it.
okay, okay, I understand. But after how many meters, more or less, you need to stop because of the
Well,
pain?
let's just say after about 3 minutes, I want to stop. I don't know how many meters because we do
Okay,
miles here, but maybe like a
yeah,
tenth of a mile,
okay,
just a
okay.
few
Yeah,
minutes.
I mean, to be honest with you, it's a bit of a tricky question. I mean, like, of course, everything we do could be endo or open is something that the body usually doesn't like. I mean, like, because it's something like external to your body. So the body is a machine which reacts to external things in a bad way. Generally speaking, it's like it's anything that we do, anything we fix is not forever. Of course, there are cases like, especially I would say, vein bypass, where I've seen patients with 20 years bypasses which are still running. If you have a vein bypass, so for
I
example,
don't
that's a
have
big, you
no
haven't.
viable vein. I
Okay,
had a
that's
study.
another thing. Okay, good. So that's good to know. So the vein bypass is usually very durable. The graft, like usually with with the like with a graft is not that durable as the vein. Having said that, it's not like it does. There are like 1,000 different possible outcomes of a bypass. I mean, like, it could be that the bypass, even with a graft, will stay pain for years, and maybe they will give you years of pain relief. The thing is, like, always thinking about, you're young anyway. You're not like 85. You're not in critical limb ischemia. You can still live like a reasonable life.
Mhm.
So like, there's always space for a bypass. I mean, especially because you don't have a vein. So essentially, it's something that can be done at any time. It depends a lot on how you feel with your life. If you feel it's very impaired, I'm sure you can discuss about doing a bypass. Or if you don't feel that constant handicap in having this kind of a short, let's say, distant claudication, then you can keep it as it is and will never go worse. Especially if you take aspirin and statin. I don't know if you take them.
Yeah, rosuvastatin and a baby aspirin.
That's perfect. Yeah, that's by keeping these two drugs and by always like having it looks like very healthy lifestyle, then you're fine. The thing is, like, to have a bypass is, of course, is invasive. No one tells you that you won't have any complication like infection, graft occlusion, blah blah blah. You get a scar, and you have there's no one who can ever tell you, okay, whatever I do will last X amount of time. It could be forever. It could be like 2 months. Another great sign is like your stents went down. I don't know how the procedure was done. I don't know the size of your arteries and many other factors, but to have stents which go down already, it's not a great sign of long-term patency of whatever you do with you. I mean, there's also the option to open the stents again. It's not something that it's not done. But again, you need to see if the stents were positioned properly, if the outflow, down, below the standard zone was okay. There are like many different options that needs to be checked. Having said that, in order to summarize, is like it's good that you have an active life. I think that's the best. If the pain is not too bad, if it was my leg, I wouldn't get a bypass. When the pain becomes untolerable, Of course, you don't smoke now, do you?
No, I quit.
Okay. That's important again. So as long as you keep your drugs, you don't smoke, I don't think nothing will go worse. The only thing can go better. So, but if you reach the point where you think really that your life is, severely impaired by your disease, then yes, you can go for a bypass at any time, because it's a bypass which is involves a graft, and like more or less everyone can do it. It's not a difficult surgical operation.
We always, tell our patients that, right now innovation is moving at the speed of light for peripheral artery disease. And, we really, really suggest that if it isn't lifestyle limiting, if it's not impairing your life, if you can tolerate the pain, really try to push through it as much as you can, because, as you said, like, you don't want, there are only so many procedures that you can have, before those become limb threatening. And I know going forward, there are some great technologies. There are some bioabsorbable stents that are in the works. And you have also Reflow Medical that has a retractable stent they're working on. So a lot of technologies are coming out that would ultimately not impair a doctor's ability to have a really good landing zone in the future for a bypass if it is ultimately necessary. And maybe they try a couple more interventions in the meantime, if those become medically necessary as well, if your symptoms do get to the point where they are lifestyle limiting, right?
Guess I'm looking for a magic pill.
Yes.
There
And
isn't
also
one.
the thing that you were asking also about the D2 trial and the endologics, like when you, so essentially artery and veins are very close to each other. So when you go down into the leg, the artery and the vein are close to each other. And there's this kind of new sort of treatment that they propose, like it's from the artery, which is all occluded, standard, whatever, you cross into the vein. You take a tour into the vein, you go down, which is pretty easy, done by our guide wires, and then you re-enter into the artery. So you do it like a bypass, the same thing, and you actually put the graft, so exactly as the bypass, but going through the body into the vein. Okay, so arteries are the vessels which are bringing the flow down to the toes. Veins are the ones who are bringing the flow from the toes and then bringing it back to the heart. So there's this technology, which is now still not like completely, of course, on the market freely, that you have a passage from the artery into the vein, which is something completely against nature, if you want to say.
Right.
And then you cross you go down into the vein, which is patent because it's not blocked. And then you come back into the artery. Okay. So you bypass the occluded artery passing through a vein. That of course can raise some questions. The main one is like, okay, what about the vein? Is it going to be blocked? And actually, we're talking about, again, the deep system, the system which is very important for you because it's the main one of your body. Actually, they demonstrated that there's not much. Of course, you need to have some criteria. You need to have the vein which is as big as, or like 2 veins, or there's some criteria which need to be fulfilled. But essentially, what happens, like more or less from the patency point of view, I've seen more or less the same patency rate of a graft. So it's more or less the same. So it's not super great. And personally speaking, also you need to have a little stamp, especially on the top, because they're putting cover stents, and the cover stents don't let the blood passing out. So if you put the stent too high, then you cover the profound femoral artery, which is like an artery which provides flow to your thigh. And actually that could be a little bit of a pain, dramatic situation. So essentially you need to have certain anatomical conditions in order to fulfill the criteria, and then the results are good. The initial results are good, but I would say it's very much comparable with the standard bypass.
Okay,
Gotcha.
thank you.